Chapter 3, Digestion, Absorption, and Transport. Digestion is the process that our body goes through to break down the foods that we consume into those key nutrients. It is also the first step that takes those nutrients and prepares them to be absorbed into the cells where we're going to use them for energy. Digestion is actually a big process, and it really is met by a lot of challenges our body has to go through in order to get those foods broken down. A couple things to think about. The very beginning of the digestive process happens in our mouth. And the mouth does multiple things. We talk, we breathe, we do all kinds, we drink through our mouth. So it really is a pretty keen process that our body is able to do all those things at once and break down these foods. The digestive tract, as we're going to learn, is not a straight line type of tract. It has to go through and maneuver around different muscles in the body, one being the diaphragm, which sits right underneath our lungs, and it's a dome shape type of muscle, and so the body has to be equipped to be able to get around that. So our digestive tract is very flexible and, like I said, not a straight line. The digestive tract also moves contents along at a very steady rhythmic movement throughout the entire tract. The majority of the time, foods move fairly steadily throughout the digestive tract, and they just move forward. They don't move backwards. In order for the food to move steadily along, there needs to be secretions or lubrications to keep that food moving along as well. We do have different digestive enzymes that we will learn about, and these help to break down the different foods to the nutrients. Once the body has taken what it needs in terms of the food has been digested, it will then be absorbed into the cells. We do have a very unique process that anything that we don't need, the waste, is then we have a point where we can get rid of that as well. Our digestive tract is called or is referred to as the gastrointestinal tract or the GI tract. Gastro means stomach. Intestinal refers to intestines that we have. So the tract comprises those areas as well as the entrance, which is our mouth, and a long tube that connects the mouth to the stomach, which is the esophagus. So the 5 main parts of the digestive tract in the order that they appear is mouth, esophagus, stomach, small intestines, and large intestines. The other 2 that are listed here, rectum, that is at the end of the large intestines, and that is a holding tank for the waste product, things that we do not use for energy and that we need to take out of our body. The anus is the opening where the waste does leave the body. Keep in mind the GI tract, it's very flexible, it's muscular, so that steady movement that I mentioned of foods going down and being digested, that rhythmic motion comes from muscular contractions in the tract. The inside of that entire tract, from the mouth through the large intestines, is a very soft, continuous type of lining, and that is called the lumen. It's continuous from the mouth down through the large intestines, and again, that is where food is going to move through. This is a great visual from your textbook that will show you the entire gastrointestinal tract. It will also take you through each of those different parts of the GI tract. It will provide what secretions are being secreted at different times. So this is a very good review to go over this prior to studying for a quiz so that you know what the progression is in the GI tract. The process of digestion begins in our mouth. That's where we will take in the foods. We will begin the action of chewing or mastication that will break up food into small particles, making it easier for it to travel throughout the tract. We do have fluids that are secreted from the glands in our mouth, specifically the salivary glands, which then work to take those particles, make them a little bit more movable or viscous so that they are easy to swallow. Our tongue plays a big role in swallowing as well as in taste sensations and noting textures and temperature changes. As we swallow food, it passes through a small tubing called the pharynx that connects the mouth to the second component of our digestive tract, which is the esophagus. The pharynx also has another prong of its tubing that connects to our air pipe or our trachea. And there is a small flap called the epiglottis that closes our trachea to prevent food particles going down our air pipe when we are swallowing. We don't want to do that. That's the process of choking. So we want to make sure that the foods go in the right direction. I want you to think of the next part of the GI tract, the esophagus, as more of a connection between the mouth and the stomach. There isn't a lot of activity that goes on in the esophagus. It primarily carries those bits of food that have been broken down and carries them to the stomach. I do want to note that the mouth and the stomach, the secretions up to this point are considered very basic or alkaline in the GI tract. So the pH is very neutral. The esophagus does have two muscular openings that you need to be aware of, the top of the esophagus and the bottom of the esophagus. And these muscular openings are called sphincters. They open and close in response to the foods that are going in, and it allows just a small amount of foods to go in. It closes and it prevents food from traveling backwards, so it will just travel forwards. In the esophagus, those particles of food that are coming from the mouth clump together, and that term of that mass that is made is called a bolus. So the bolus will then move into the stomach. In order for it to move into the stomach, the lower esophageal sphincter will open. The bolus is then dropped in there in small amounts at a time. The sphincter then will close. The pH changes greatly in the stomach. The stomach, it does not have a neutral pH, but it is very acidic. I want you to think of battery acid. There is acid in the stomach. We have a stomach acid that works to break down and digest certain foods, notably proteins. Proteins will begin their digestion and uncoiling in the stomach. As the bolus enters the stomach, the acidic secretions are released, and the bolus then is combined with that, and a semi-liquid mass is created. That mass is termed chyme or chyme. It's pronounced both ways. The chyme will then move through the stomach. There's an opening at the bottom of the stomach, just like the esophagus, a sphincter. It's called the pyloric sphincter, that will then move the rest of the food particles, which are now chyme or chyme, into the small intestine. One last thing to note about the stomach, I had mentioned that protein responds well to an acidic environment, and it does begin its digestion there. Carbohydrates and fats, however, do not. It is necessary for them to travel to the small intestines for digestion. They do not do well in an acidic environment. In order to protect the carbohydrate and the fat particles, the stomach also releases, the cells of the stomach also release another secretion called mucus. And mucus protects those particles from being broken down and destroyed and gets them to the small intestines. I wanted to throw this picture in to actually show you an example of those sphincter muscles. So you can see the top part shows basically the lower esophageal sphincter, and it's showing the bolus coming from the esophagus. The sphincter is open, and the contents will then go into the stomach. The bottom picture actually shows how then the sphincter closes after the contents have been put into the stomach. The next part of the GI tract is the small intestine. The particles that are coming from the stomach, the chyme, then dumps into the small intestine. However, remember that the stomach is very acidic, and the nutrients that are coming, specifically the carbohydrates and the fats, need an alkaline or basic environment in order to further digest. How the body does that is there is a common duct that comes from two other organs in the body, the pancreas and the gallbladder, and they feed into the small intestine, and they drip fluid, specifically pancreatic juice from the pancreas, and from the gallbladder, bile. The gallbladder is a storage tank for bile. It is not produced there, it's actually produced in the liver, but both of those organs secrete these substances that will change the environment, and so it actually makes the small intestines an alkaline environment, just like the mouth was and the esophagus. And so that is where about 99% of digestion and absorption of carbohydrates and fats occur. There are three segments of the small intestines. The very top part of the intestine is termed the duodenum or the duodenum, pronounced both ways. The second part is the jejunum, and the third part is the ileum. Those three segments collectively are about 10 feet. So they are coiled in there, very, very large. Of the three segments, it is the middle section, the jejunum, where we see the majority of digestion and absorption occur. The final part of the GI tract is the large intestines or the colon. Once digestion and absorption have taken place, there will be waste product, things that the body is not going to use. And that is the purpose of the large intestine, to take that waste product and to remove it from the body. The waste particles that are in the large intestines combine with the water that is in large intestines, and those collectively create stool or waste product. The stool then remains in the rectum, which is a holding tank, until the body is ready to eliminate the waste. Waste is eliminated through the anus. This is a great visual that just gives you an overview of the different pHs that we see within the digestive tract. Remember, we had mentioned that the mouth and the esophagus fall in the middle, a pH of about 7. It's very comparable to the pH of water. You can see saliva is right under that. So again, creating a very neutral environment in the GI tract there. If we move down to the very acidic area, we can see that gastric juice, that would be stomach acid, falls way down there, not quite as far as battery acid, but it is highly acidic as well. If we move up the pH scale, we see highlighted pancreatic juice and bile, which we know dump into the small intestines to help create that basic environment so that our carbohydrates and proteins can be digested and absorbed. A couple other key concepts and vocabulary words from this chapter that you should be aware of. The first term is peristalsis, and that is that rhythmic motion that I was mentioning, how food works through or moves through the GI tract. It's actually circular and long kind of pushes of the muscles. The best way that if you can visually think about it is if you've ever seen a snake eat its prey. Snakes like to eat rodents, and you know, snakes are long, and you basically, if you feed a snake, a rodent, you can see it in clumps moving along the length of a snake. And so that's how I like to think of peristalsis. That's that same kind of motion that's happening in our GI tract. Everybody has a different rate and intensity of the contractions of their peristalsis. Factors that could interfere with that, there are some medications that slow down the rate, that slow down the motility of our GI tract. There are some individuals that have very high, naturally, very quick and fast peristalsis. And so that could lead to problems. Going along with that, our stomach has multiple different types of muscular contractions, different muscles. There's a visual picture you'll see of them in the textbook, as well as I believe in this slide deck. And so that's also part of the digestive process. Here's just a visual picture of those stomach muscles that I just mentioned. This is a great summary of all the digestive secretions that occur in our GI tract. I like it because it targets which organ these glands are or organs are in and what they secrete. So for example, on the top one, in the mouth, the salivary glands secrete saliva, and the function for that is to break down some of the carbohydrate will begin to be broken down there. When we get into the chapter on carbohydrates, we will talk about which kind of carbohydrates will start to initially digest in the mouth. As we move down the summary list, the second organ that's targeted, the stomach, the gastric glands, they secrete that gastric juice, which is stomach acid, hydrochloric acid. It will uncoil those proteins to help break down proteins. We also mentioned mucus. That is another secretion from the gastric glands, part of gastric juice, that helps protect those stomach cells as well as that chyme that is going through. Next is listed the small intestine. In that part of the GI tract, we have the pancreas that feeds in through the common bile duct, feeds in pancreatic juice. It is a very, remember, basic juice that is going through. It's actually bicarbonate. Sodium bicarbonate, just to give you reference, is baking soda. So it's very comparable to that. So bicarbonate will neutralize those acidic gastric juices. The liver and the gallbladder, I kind of group those together. And the reason being is, remember, the gallbladder is just a holding tank for bile, and then but the gallbladder will release the bile into the small intestines when needed. We'll see that bile goes hand in hand with fat digestion. And lastly, listed there, again, the small intestines within the glands there is intestinal juice. There are specific enzymes that we will learn when we talk about the different chapters of the macronutrient digestion and absorption, and we'll find out how those help to break down carbohydrate, fat, and protein. Going along with the chart that you viewed in regards to the secretions that happen in the GI tract, I want you to also be aware of 3 hormones that are involved in this process as well. The first hormone listed is gastrin. Gastrin is secreted from the stomach, so it is a stomach hormone, and it actually is secreted in response when food is coming from, is traveling from the esophagus into the stomach. Gastrin will be secreted, and it will tell the stomach to secrete that hydrochloric acid or stomach acid so that the acidity in the stomach remains very low. The second hormone, secretin, is actually secreted from the upper part of the small intestine. It is secreted when the acidic chyme is coming into the small intestines. Remember that we need to change that environment to a basic environment so that carbohydrates and fats can get further digested. So secretin is secreted, and when it is secreted, that stimulates the pancreas then to dump in or to drip in those bicarbonate-rich juices to help create that alkaline environment in the small intestine. The last one is cholecystine-kinin. For short, it's referred to as CCK. And it's a hormone that is in the small intestines, in the wall, and it is secreted in response to fat, sometimes a little bit of protein too, but primarily protein is broken down in the stomach. But fat, it is secreted. It works kind of the same way that secretin does, but instead of calling on the pancreas, it actually stimulates the gallbladder to secrete the bile into that common bile duct, again, to get that alkaline environment in the small intestines. I would encourage you to take the time to read through this, the digestive fate of a sandwich. If we think of a sandwich, we have a combination of all the macronutrients. We're going to have carbohydrate from the bread. We will have some protein source in there and probably some form of fat on the bread to give it flavor as well. So it takes you through the process, organ by organ, of digestion. This slide will cover the mouth and the stomach. And this slide concludes the sandwich digestion through the small intestines and the large intestines. Once digestion is complete, the next step is absorption. So getting those broken down nutrients to the cells that they need to go to. The majority of absorption does happen in the small intestines. Remember, I had mentioned that there is a lot of surface area. It is 10 feet long. There are different techniques, meaning that there are some nutrients that can cross by themselves over the barrier of the small intestinal wall. There are some nutrients that need a little bit of help. That's where our vitamins come into play. And then there are actual nutrients that need help. They need some energy, specifically our glucose or carbohydrate and amino acids. This is an important visual picture of the small intestinal lining. if you can picture finger-like projections coming up on the lining of the small intestines, it is through those finger-like projections that we actually absorb the nutrients. Sometimes that villi can be damaged. We will talk about that further when we talk about some GI disorders. And if that villi is flattened and it can't absorb nutrients, then we're going to be in trouble. Within our gastrointestinal tract, we also house different types of bacteria. That house is called a microbiome. And in a healthy GI tract, we have bacteria that thrive and that they actually ward off the bad bacteria that can lead to disease and infection. So most of the bacteria in our body is not harmful. We tend to call it good bacteria. And so there's definitely benefits of making sure we have that bacteria in our body. Our diet does influence that bacterial presence. If you've heard the terms probiotics and prebiotics, now you're going to learn how foods contain these. So think of probiotics as the actual bacteria. Okay, so if you take a supplement that is a probiotic, you are actually putting healthy bacteria in the body. We also can get that healthy bacteria by the foods that we consume. We have to consume foods that have live cultures. Two examples would be yogurt or kefir. There are others, but those are the ones I just have listed here. Prebiotics are not the bacteria itself, but it is the fuel or the food or the fertilizer that helps the probiotics, the good bacteria, stay healthy in the body. The best prebiotic you can consume, you can of course take a supplement, but fiber is our best prebiotic. It feeds those healthy bacteria. If our GI tract, our home of bacteria, is healthy, then we actually produce many different vitamins within that as well. Highlight 3, common digestive problems. Probably the most common digestive problem, or one that you hear about the most, is choking. We've mentioned this earlier in the slides that choking happens when that epiglottis flap does not close completely and foods will slip into the trachea. And so if you have food particles in your airway, it definitely cuts off your breathing. If you've ever choked, it is a very scary event, and it really can be very dangerous. There is an international sign for choking where you basically cross your hands underneath your throat. I think people just do it without even thinking that they're doing it. It just is a natural thing to do. If you've ever heard of the Heimlich maneuver, that's the way where we can try to expel those particles out of the trachea by creating force to push them out. There are foods that are commonly associated with choking, things that are very hard, dry, little pieces, those types of things. Be aware of some of those. They are listed in your book. Some of the best ways to prevent choking: to slow down the rate of eating. When we are eating fast, we are also bringing in air with the big particles of food. So if we take our time and we chew our food, those are going to be our best bets to prevent choking. This is a visual picture that just actually shows what happens during the choking process and how that epiglottis does not close and foods then will enter into the trachea. Not the funnest topic to talk about, but vomiting is also another type of GI disorder. It's actually a mechanism of the body to protect oneself from either a foreign particle or some kind of toxic solution or food. Medical treatment is, very important. We kind of think of vomiting as something that can't be really dangerous, but it actually is dehydration. Because when you vomit up foods, you're also vomiting up liquids. And so dehydration certainly is our biggest fear. So our first line of defense dietarily is when you're able to consume anything that you do, do water. Sometimes you will have to do an electrolyte solution as well to replace some of the sodium and potassium that is lost. There is vomiting that also is self-induced. That tends to go hand in hand with nutrition. We do have a section where we will talk about disordered eating, and some individuals actually use this as a mechanism if it's for weight loss, for just control in general. So we will discuss that further. But again, dietarily, our biggest concern with vomiting is to hydrate. On the other spectrum of vomiting and contents coming back up, we can also have contents going quickly through the body. When our stool is not formed, diarrhea is what can happen. It is a symptom. It is not a disease. The water that I mentioned in the colon area is not removed and absorbed like it's supposed to create waste. And so it actually just kind of washes everything through. Believe it or not, this is really an important symptom to talk about in regards to GI health and GI disorders. You can see listed here, there are various medical conditions that contain this symptom. If we think of them, an umbrella term for all of them. The umbrella term is irritable bowel syndrome. There is something in the bowel, so something in the GI tract that is not allowing the body to process the foods as it should. I find with that diagnosis, it's very vague, and it leaves some individuals for years wondering what they can do to help, combat the symptoms. We do know that irritable bowel syndrome is a collection of symptoms. Diarrhea is just one of the symptoms. It actually can go back and forth with the opposite, with constipation. There can be abdominal bloating. There can be other factors involved. Some individuals have parts of their GI tract that are very spastic, and so things go quite quickly through that. So there are lots of causes. It's difficult to treat. Colitis is another type of GI disorder where diarrhea can be a symptom. Itis at the end of a word means inflammation. So this is the inflammation of the large intestine or of the colon. So that definitely can be an issue. Dietarily, there are things that can be done. Most of the time when the large intestine is inflamed, we want to get rid of that inflammation. So we want to have foods that are very easy to tolerate, that don't have a lot of fiber in them at that particular time, because fiber makes the GI tract work a lot. So at that point in time, if there is a episode of inflammation, then we tend to remove the fiber from the diet for a while. And then the last one that's listed there, celiac disease. This is a disease that relates to our small intestines and those finger-like projections that I mentioned. When gluten, again, a protein that is in wheat products, hits certain individuals, their villi, over a period of time, it's very toxic for them, and it can flatten that villi, and so then absorption of nutrients does not happen. The only treatment for celiac disease, if it is confirmed, is to follow a gluten-free diet for the rest of their life, and that villi will regenerate if gluten is not present, but it is a toxin for them. There are some individuals that are gluten sensitive, meaning that a little bit of gluten can bother them. But someone that has celiac disease, it is confirmed through a biopsy of the small intestinal tissue. And it's about 1% of the population, they must eliminate gluten lifelong. Now, there is a lot of hype in the nutrition world, not all reliable information, that following a gluten-free diet can help someone lose weight. Really, there's no correlation. If you are someone where your small intestines can handle gluten fine, then there's no reason to keep it out of your diet. It's a very limiting diet. Again, treatment, if you have chronic diarrhea, just like with vomiting, hydration is the key, the number one key first. On the flip side of diarrhea is the opposite, and that is constipation. Again, it's a symptom. It can definitely relate to some GI disorders. What has happened here is that the fluid that was in the large intestines has been absorbed, and there's not enough motility to move waste product through. So waste elimination is impaired. Probably the most common causes of constipation are the type of diet that's being consumed and being inactive. If you are someone that's active, that basically moves everything through your GI tract well. So activity is very important. In terms of diet, if you are following a very high fat, maybe a lot of fast foods, not a lot of vegetables, not a lot of fruits, that have fiber, again is going to move things through, then that can be a cause of constipation. There are medications also that can work against your GI tract working well. There's actually some vitamin supplementations. If you are told that you should consume iron as a supplement, many times that can lead to constipation. So dietarily, how this relates, if you were to talk to someone that was having issues, this is considered a GI symptom, that the recommendation would be to increase the fiber intake, eat more whole foods, high fiber foods, but going along with fiber, the big key is to add a lot more fluid to your diet. So if you're just eating a bunch of fiber and not drinking a lot of water, it's going to sit in that GI tract like cement. So it's very important. Think fiber and water together along with physical activity. Other GI conditions to be aware of where diet does make a difference. The first one listed here is hemorrhoids. Hemorrhoids are basically swollen rectal veins that can become very painful. They are usually it happens if someone is straining when they need to go to the restroom, they're constipated a lot. Hemorrhoids can develop. It's also very common in women when they're pregnant with the extra weight, or if someone puts on a lot of weight, these veins can pop out and can be very painful and not very comfortable. The next one that's listed is diverticulosis. I want to direct you to the picture here. This is a picture of the large intestine. And in the large intestine, you can see listed there's little growths, little bumps that can happen on the large intestine. Those are called diverticula. And those can happen over a period of years. So remember I had mentioned that the lining of all the organs, the lumen, is very smooth. When things move through the system, well, we tend not to have a problem. But if things don't move through the system really well, over a period of time, these little pouches can develop. It's basically the tissue pushing out. And that can be very diet related, that those diverticula occur. That doesn't mean it's going to happen just as you get older, but if you are not eating a diet that's very high fiber, if you have issues with constipation without things moving through the system, there is the possibility that these little growths or the tissue pushing out can happen. The pockets itself are not a huge concern. What happens is if you continue having issues where things are not moving through the GI tract as you'd like them to, and now you have pockets, those pockets can accumulate waste. And that waste can stay in those pockets and fester and become inflamed. So diverticulosis will then turn into diverticulitis, which is inflammation of those pockets. That is extremely painful. Many individuals have to go and be hospitalized for that because it becomes a large infection of the colon. Once the pockets are developed, they never go away. So the chances of having diverticulitis can happen multiple times once those diverticula have been produced. Treatment for diverticulosis and diverticulitis are similar to when I spoke about colitis. So if you know that you have those pockets, the treatment to prevent any inflammation is to have a diet that's very high in fiber, lots of water to move things through the large intestines well. Once you have an inflammation, diverticulitis, then the treatment for a short period of time is to lay off of the fiber, lay off of anything that's going to cause any inflammation. So then it becomes a very plain, low fiber diet, and it lets that part of the bowel, the large intestine, rest. The other two items that are listed here are actually treatments for constipation. There are medications that can move the waste through the through the colon. Those are called laxatives. There is also a practice called a colonic irrigation. That is something where you can go in and have everything kind of cleaned out. It's considered a healthy type of thing, but it actually can be very dangerous. The cells in our intestines, they regenerate themselves about every 72 hours. So we don't really need any intervention like that. Belching and gas are just ways that our GI tract can get rid of extra air. Belching is going to come out through the mouth, whereas gas is going to come out through the large intestine. There are certain foods that cause intestinal gas, and they tend to be those healthy foods, those really high fiber foods, lots of the sugars and starches and fibers. Some people are very sensitive to it, so it's a matter of just figuring out what works best for your body. One thing that can definitely help with belching is to slow down the rate of eating as well. Diet can play a factor, weight gain can play a factor as well. When you have extra pressure on that GI tract, that can lead to some air difficulties. Another very common GI disorder is called, very long name, gastroesophageal reflux, or a shorter term is GERD. So if we think about that, gastro, stomach, esophageal, stomach, so it's actually contents refluxing up from the stomach back into the esophagus. We can just call it heartburn. It's the same thing. So reflux is also known as heartburn. There can be a ton of causes of heartburn. And so, it's very individualized. Most of the time, heartburn tends to be caused by eating could be very spicy foods. It could be very high fat foods. When you consume foods that are high in fat, that sphincter So the lower esophageal sphincter that's supposed to open and close just to let a little bit of the bolus into the stomach at a time can become kind of relaxed. And when it's relaxed, some of that acidity can come back up into the esophagus. So we do have different treatments. Dietarily, looking at foods that might be a cause. Also could be how you eat. You don't want to eat when you're sitting down. I'm not sitting down, but laying down, you know, or those types of things. Antacids or acid controllers. Now this might make sense to you now that you know about digestion. Antacids are a form of bicarbonate. So remember, thinking back to the digestion that we talked about, is we want to create a more basic environment because that acidity is causing problems in the esophagus with reflux. So if we take bicarbonate, the antacid, it's going to help decrease that acidity. Over a period of time, and this is chronic, heartburn or GERD or GI reflux, any of those terms, can lead to problems with that esophageal tissue. If you have acidity coming back up over a period of time, that acidity is going to change how those cells work in the esophagus, and we can see something. One disease called Barrett's esophagus is actually a form of cancer that can occur. So heartburn is really not something to just say, oh well, I'll just take some antacids here and there and I'll be fine. If you have chronic heartburn, you need to get to the root of the problem. So this is a great picture that shows how that sphincter, that lower esophageal sphincter, can weaken and how the stomach contents or the acidity then comes up into the esophagus. The final common digestive GI problem is ulcers. Ulcers are sores that can develop in the tissues found in the stomach or the small intestines. They typically are caused by a bacterial infection, and so medication is the first line treatment to get that tissue back to normal and to reduce that sore. The use of anti-inflammatory drugs like Aleve over a long period of time, chronic use, is a very common way that ulcers can develop now as well. I see this sometimes with athletes. If you are using a lot of, like I said, Aleve because you've got sore muscles and you have the big jug of Aleve from Costco and you're utilizing it a lot during the day, over a period of time we will see that that can lead to ulcer development. The other way that ulcers can develop is that some individuals can secrete an excessive amount of gastric juice. A lot of times that is linked to individuals that have a very high stress level, are very anxious, might be a type A personality, those types of things, and we'll see that that extra gastric acid, again, basically is like burning a hole in the tissue. In terms of ulcer treatment, again, first line treatment will always be antibiotics or something to treat the bacteria, but there are some dietary interventions that can take place as well. In the next couple of slides, we'll show you some recommendations. The next two slides we'll actually go through all of these different GI common problems, digestive problems, and it will actually list some dietary strategies most of the time to help alleviate the symptoms. So I'd like you to take a look at these, be able to recognize some of them that might be helpful if you are having any of these issues.